Morning, everybody, and welcome to the South East Wide COVID-19 Homelessness Response meeting. So we've got a meeting this morning which is going to involve overview from MHCLG in a moment, discussion with Olivia from NHSEI, a conversation about the homelessness transition framework which we circulated previously, and then a conversation about future meetings and the webinar. So that's the idea. If you'd like to use the chat box, then do feel free to pop any questions that you might have in there. Use your raise your hand icon to raise your hand if you had any questions. We'll see if we can get to you. The meeting is being recorded. So I think at that point I'm just going to hand straight over to Lucy from MHCLG. Hopefully you're online with us, Lucy, and you'll be able to take us through your first session.
Thank you. Good morning, everyone. My name is Lucy Baker. I'm a Rough Sleepers Advisor at the Ministry of Housing, Communities and Local Government. I've come here today just to kind of raise awareness, really, of a funding prospectus which was issued a couple of weeks ago, which is aimed at local authorities to help them with their next steps following the exercise to move rough sleepers into accommodation. We're now issued this funding programme to enable that move on to happen. And the reason I'm bringing it to this meeting today, like I say, is to raise awareness, but also because some of the bids that we're expecting to come through should really be done in close partnership, in particular with health colleagues, as we know, and the whole premise around these meetings has been about developing that relationship between homelessness, housing and health. So you may well be approached by local authorities, housing departments or rough sleeping leads to help put something together where it may involve ongoing support for sleepers as they move forward. Sorry, there's an echo on the line. If everybody could please mute, that would be great. Thank you. So you may well be approached, but equally to ask health colleagues to reach out as well. In the guidance, there is a section which kind of quite a lengthy section really, which really emphasises the importance of health circumstances and support needs assessments being done, because obviously we want the funding that we issue to have long-term impact to keep rough sleepers off the streets, and obviously they need to be pitching their housing options in accordance with the need within their population. And I appreciate that some of those conversations are at different levels of advancement around the South East. So, it touches on ensuring that, that people's points within their journey, within their substance misuse or mental health journey are recognised. It may be that some people perhaps need a different intervention before moving into long-term housing. It's really kind of, I guess, underlines the importance of tracking people through as they move on so they're not lost from their health systems and that their health care can follow them through. And also, from an adult social care perspective, ensuring that appropriate care act assessments are done in case there's anything, any adaptations or care packages that need to be issued, but also that people who are at risk of COVID are identified and that the right housing option can be developed for those rough sleepers too, should they require shielding, etc. Essentially, there are two elements to the funding. There is a very short-term revenue-based element, which is about moving people on through the Everyone In exercise, and then there is a longer-term funding element looking at which has some capital funding within it, and that is looking at the development of longer-term homes. So that is a bit of a whistle-stop tour. I can take some initial questions, basic questions on it. It is quite complex prospectus, to be fair, so I wouldn't want to get bogged down in the intricacies of that, but of course everybody's welcome to make contact, drop us a line if you have any particular clarifications. I can see there's a hand up. Was that Robert?
Hello, yeah, Rob from Portsmouth. I was just wondering, we've started these conversations, we've started working up some sort of proposals to put to our housing department. And we've been told that they have a coordinator from MHCLG working with them. Sorry.
Yes, so there's my team and my colleagues. We work with various local authorities across the country. So yes, Portsmouth does have a rough sleeping advisor. Yes.
Brilliant. It would be great to understand how that link can be sort of developed better, because we don't know that link. We only have our links with the council, and as you can imagine, we're a big and complicated. Well, why am I saying that to you? You're a big and complicated group. Yeah. You understand.
Yeah. If I can, perhaps Karen can give me your email address, and I can put you in touch with the Rough Sleepers advisor for the area.
Awesome. That'd be brilliant. Thank you.
So we've got Kate.
Hi, yeah, I'm Kate Holburn from Oxfordshire, and I work within public health, so I'm linked within the response to this, but I haven't read it in detail. So if this is a fairly obvious question, then do excuse me. So you've said that one of the things that would be covered in there is the response to COVID and reducing the risk. Is that actually included in what should be put forward for the funding for that, or is that an extra outside of that bid?
If I've understood you correctly, so what we're seeking to identify is rough sleepers, and in particular very vulnerable rough sleepers and those that are at risk of returning to the streets, making sure that they've had a comprehensive needs assessment so that an appropriate housing related bid can be put forward to meet the needs of those individuals.
Okay. I suppose my question is it actually related to a kind of COVID care approach, so that if they had symptoms of COVID, then it's funding for finding an appropriate place for them?
This is more about increasing the overall national asset of accommodation available to rough sleepers in the longer term.
Okay.
So there may be a mixture of options coming forward from local authorities, which could be self-contained accommodation, or could be development of supported accommodation, for example, or depending on their needs and capabilities, going into the private rented sector. And there may be some, light level housing related support only needed for those people. It's not about developing COVID care sites. It's more about longer term homes for rough sleepers.
Okay, thank you.
I don't know if I can see the next hand, or is that your hand there, Kate, still?
We haven't got any other hands up. We've got a note from Liz Liz in the chat box, just making it clear that the deadline for submissions is 20th of August.
That's right. Thank you, Liz. Yeah.
Okay. Anybody else have any kind of questions? Thank you very much, Lucy. That was really, really helpful. We've got a Colette who's got a question here. Colette?
Yes, good morning. This is Colette Van from Surrey County Council. I wondered, can the bid include outreach provision in the old sense of the word? So like mental health, substance misuse, alcohol misuse, care within the community for the rough sleepers that we've moved into emergency, temporary and move on accommodation?
Potentially. So going back to the sort of two funding streams within this prospectus, there is some short-term revenue funding which is only available until the end of March, and so there might be some increased capacity required from substance misuse, mental health, etc., to enable that person to move on, but that wouldn't be about developing a longer-term service. On the capital funded side of the bid, there is some revenue funding which sits alongside that, but the revenue funding for that would be connected to any capital units that are developed. So I guess this isn't really so much about, building necessarily outreach teams that sit on their own. It's more about there may be support connected to specific housing units, or there may be a shorter term need for an increase in support to enable more people to move on quickly between now and March.
Has that addressed your question, Colette? You're satisfied with that?
Thank you very much. Sorry, I had muted myself. I have another question, if you don't mind, and that is the 130 million that's available for capital, if it's not all grabbed per se, will that be carried forward into another funding round?
So the capital programme is actually a 4-year programme. It was announced at the spring budget. What we've done is we've rolled some of the money forward to make more money available in year 1. In the end, because we recognise, the number of people that need to move on quickly. So there will be a continuous market engagement process. We've yet to determine the exact level of funding for years 2, 3 and 4 and the process. But the idea is that, yes, it would be possible to access some of that capital funding in future years.
Thank you.
Kate?
Hi, just one other question. What is the link between this and the substance misuse grant that's coming out for the homeless? And are they referencing each other? And in particular, from a timing point of view?
They do make reference to each other. The 23 million substance misuse will be overseen and administered by PHE. And I believe that they're still working out the mechanisms. Again, that is multi-year funding, but in year 1 they have identified some specific areas in the country that money will be targeted to. But as for the mechanisms and the timescales, I don't believe that has been issued yet.
Okay. I suppose so. If the timings don't quite match up, it might be difficult for those two to reference each other.
It may well be, but I don't know where PHE are with that particular fund at the moment.
Okay, all right.
Lucy, I can certainly say we're not. It's not been launched yet, and we're imagining 4-week turnaround, so we're not going to be in a position to receive bids back by 20th of August. I think the usual routine with this is, of course, they need to link because they're focusing on the same thing, but you shouldn't rely on each other. We've only got the 5 areas, and I know Oxford is one of those, Kate. But if you're developing separate bids, then you can't be relying on one application being successful in the earlier application that's going in. So it's a bit challenging. I understand that. We need to think about how they might link together, I guess.
Yeah. Okay. Thank you.
Lucy, I know you've got to go pretty sharpish. You've got time for any more questions? If anybody has any others.
Yep. Colette, is that an old hand or a new hand you've got raised there?
Sorry, that's an old hand, a legacy hand. I'll take it down.
Legacy hand, I love that. Okay, any other questions or comments before Lucy needs to shoot off? I think that's it. So thank you very much for your time this morning. It's been really helpful, and everybody needs to get in touch with local advisors to talk about their local plans. If they've got any specific questions about how things might work for them on their patch,
Yeah, absolutely. Okay.
If you're not sure who that is, get in touch with Lucy, and we'll make sure that you can find out who that is. Okay.
Okay. Thanks a lot. Enjoy the show. Bye.
Great. Thank you very much. Cheers. Lovely. So there we go. Thanks very much, everybody who's joined us this morning. If you've joined us while that was going on, then you might not have heard that we're recording the meeting this morning. So the session's being recorded, so that folk who haven't been able to join us this morning will be able to pick up a bit of the conversation later on. So next on our agenda is we've got a regional and national update from Olivia from NHS England and Improvement. Olivia, over to you.
Thanks, Jason. 3 things, I think, from yesterday's national call. We received an update on the health inequalities work that was completed by a national NHS EI task and finish group. We're expecting the 8 recommendations to be part of what is known as the phase 3 letter to the NHS, which was due to go out yesterday, might go out today because the people plan was eventually published yesterday. But some of the recommendations, whilst they aim to address wider groups of people, actually are really relevant for the homeless population and the work we've been doing. So Three ways in terms of focusing and addressing on wider determinants of health and the NHS role in influencing these. So protecting those at greatest ongoing risk from COVID is one of them. Restoring services to ensure access for those who are in greatest need. And then accelerating plans to reshape services to improve outcomes in the long term. And that action, or those actions, need to be underpinned by better community engagement, better data, and clearer leadership and accountability. So that was quite a strong and powerful message. We're hoping that it will be in that letter to ICS leads, chief execs of trusts, primary care commissioners, etc. And some further work and expectations will come out of it. So that was one of the points yesterday's, recognising as well that there's need to be training and support for the workforce, and that was critical. So we've discussed previously the access to GP practices, sometimes the physical constraints of not being able to provide ID or addresses in registering, and even once you've registered, if it's not a specialist service, actually accessing the services or being identified to access the services that you need. So that's what the national team is working on at the moment as a top priority, which is supporting GP practice and their staff in registering and providing good access to individuals who do not have an address or a form of ID, or might not necessarily need a standard offer and have some reasonable adjustments built into the offer. The second point was about learning some lessons from the last 4 months, and Olivia Butterworth, who is our national lead, was saying it was really difficult to identify who to speak to in each one of the regions, and that was just within NHS England improvement without MHCLG or PHD or charitable sector. So apart from London, that had already quite a good infrastructure in place and a multi-agency approach to homelessness, it was really difficult outside of London. So I think, like today, we've made some really good connections and managed to get together, but we can all reflect that it's been quite a difficult journey, and it's not finished in terms of keeping the connections live and making sure that we speak to the right people. And finally, the last question was about forward planning, and that was the ask of all the regions. So what are you doing? We did a session on winter planning, and it might have been more questions than responses last week. I wasn't there, but I know that went on. And what are you doing to continue supporting people as part of the Moving On programme, as Lucy described, knowing that there might be further surges of COVID, knowing that winter is coming and it presents its own challenges. So that's it from me, Jason. I'm happy to take any questions, but I think it fits quite neatly between Lucy's presentation on the prospectus and then the transition framework that you're going to speak about.
Thanks very much, Olivia. Does anybody have any questions or comments at that stage? It sounds not. So thanks very much. I shall move along. So the next item on the agenda was about the South East Multiple Exclusion Homelessness Transition Framework, which I know Karen sent around with the notes before the meeting. Karen, are you able to pop it on the screen? Sorry to put you on the spot like that, but if I disappear into trying to put it on the screen as well, I'm not going to be able to see any of the conversation in front of me.
Bear with me. I'm just showing it now. There we go.
Wonderful. So we sent it around. We can have a quick flick through the slides so that we can just demonstrate what it is. So we've got the contents page there, and the idea of the framework is to put forward a few principles. There are 7, I think, so far, principles that we described as kind of what good looks like, drawing on work's been done in other parts of the country by other organisations. And then an opportunity to have a think about where you fitted before before COVID, where you are now, and where you want to be in the future in your local area. And there's some ideas about, as I say, what good looks like. So what ambitions you might have about using the framework to shape some of your thinking about transition. So there's some slides that you can see in front of you there. The principles at a glance. This is a sort of bronze, silver, gold version of what good looks like. Thinking about where were you before COVID-19, where are you now, and where is it that you want to get to? What's your ambition? And the idea being this be a document that helps you to kind of stimulate a multi-agency conversation locally with your partnerships. Multi-agency systems, multi-agency partnerships are a key part of the work, one of the principles there. Also looking at leadership, which you can just pass on through. Where were we? Where are we now? Where do we want to be? The next principle there is around co-creation. So working with people who use services to develop the services that they're going to benefit from, making sure that they are central to all the planning that we do. We've got health as a separate principle, and we talk about a health-led approach. So there's a focus on health as an aspect, then also finally accommodation. So I'm not going to talk through the detail of what's on the slides because you've already had the slides and you can all read perfectly well yourself. But this is an opportunity for us to kind of hear a bit more from people about what they like about it, if there's anything more that we could do to improve it, how you're thinking about you might use it, and also thinking about are there any other practice examples that we could include, drawing on what you're doing locally. Anything that you wanted to showcase in the work that we're putting out. So I shall just pause there and just see if there's any feedback people wanted to offer, questions people had, or thoughts about how they're using it. Michael, go ahead. If you're speaking,
I will unmute and try again, shall I?
Yeah. Go again.
Michael Verriard, Buckinghamshire Council. It's probably just more a question about sort of the process. Is this ultimately going to be sort of signed off by an agency or a group of agencies? I suppose I'm just thinking is in the end game in terms of the ownership and the sort of status of the document.
So that's a good question. I know it's been one of the conversations that we've been having in the Task and Finish group about how we push this forward. It's not a PHE owned thing. We're not going to try and push it through Public Health England's publication standards. Our ambition is that this be owned by the South East Association Directors of Public Health network. So it comes from local authority public health, owned by local authority public health, kind of corporately rather than any one individual organisation. Is that a fair summary, Karen?
It is.
Yeah.
The ADPH group have been privy to this. So there was a briefing that went to them originally. They were supportive of that. They saw the draft version and they've been given this latest version as well. So they're aware of what we're doing because they will ultimately be the local area champions for this piece of work.
There we go, Michael. So yeah, public health led, and ADPH network as the kind of approving, if you like, body.
Okay, thank you.
But I think the idea is that it's a system-wide approach to this. So taking it through your local systems will be a key part of this because of the multiple agencies involved in delivering a strategy around this group. So this was just a tool that you can use to help structure that strategy, really.
And if I may just add, it's Olivia here. As you just said, Karen, it's being referenced as a tool. So Emma and I have prepared a paper to go to the South East Senior Leadership Team that is NHS England, but with the Health Education England representative, Alison Barnett from Public Health England South East, and all the ICS leads across the South East. So That paper basically describes the work to date, the opportunity and the need for a multi-agency approach in responding to the MHCLG prospectus, but also identifies why homelessness is a health issue, and provides the framework as a tool to self-assess and maybe help deliver some of that as a system across sectors and agencies.
Great, thanks for that, Olivia. Rob, I can see you've got your hand up.
Yeah, just a reflection, really, just sort of saying it's also there for people if they want to reach out to people that are featured in there for, ideas, for assistance. It's, I think, networking and engaging with other teams and finding, what's working in different patches. I think that's quite a good use for it as a tool. So just, wherever the buy-in lays, at whatever senior level, there's still a really good opportunity to network with other practitioners and other people sharing, pretty similar problems and a similar population group who are, as we know, transient. So they could be on any of our patches at any point. So I think it's really good for sharing those examples.
That's great. Thanks very much, Rob. And we've got something with your name against it, I know, in the framework. So absolutely, that's the idea.
I'm just bored and lonely, Jason. People to email me with things to talk about. I like that stuff.
Okay. Well, okay, we can all get in contact, Rob, make you feel better. But yeah, so that's exactly the idea. So there's contact details for people with some examples at the back, which you can flick through to and have a look at and see how that might apply locally, and then follow up. Great. There's a couple of questions in the chat box which I'll come to in a moment. Anybody else? Any other comments or questions? Okay, so there's a request. Can we recirculate the framework? So Jackie Stevens, will make sure we've got your email address there, and that if you haven't got the framework, make sure we get it sent to you. So that's good. There's also a request from Debbie. Could people on the phone say the names in the chat? If you're on the phone and you can't get to the chat box, then that might be tricky. But if you can pop your name in the chat box, that'd be really helpful. Any other questions or comments about the framework?
Can I just ask, it's Karen, if obviously we put out a plea for examples from local areas. When you're using the tool, if you find that you are identifying yourself as falling into any of the silver or gold categories, it would be really helpful to share your experience. So we'll get this signed off as a final tool, but actually we want it to be a dynamic tool so it can still be added to. So don't think that there is a cut-off point. When you do your review, please feed in. You can see it's not War and Peace, they're just very small examples, but it will help others within the system, as Rob said. So don't feel that there's a cut-off point. If you want to contribute and your local area is not in the practice examples at the back, then please come forward, and we're very happy to add you.
Okay. Thanks for that, Karen. Anything else?
Can I just ask, do people feel as though they can use this as a tool locally? Will it be of benefit?
Michael, go ahead.
Thank you. I mean, I think it's a really good overview. I think it probably goes back to my earlier question of how it gets sort of picked up at a local level, and what sort of status is given at a local level as a sort of a plan. So it was interesting to understand that it was owned by, say, the Associated Public Health Networks. I think there's a lot of detail in there, and it feels like it will be useful to be able to kind of go in there and in some ways pick what's useful for our particular local circumstances. I think probably the key benefit, it just gives a framework that we can, I guess it kind of makes the sense that we're all in it together a bit, in that there's a regional wide thing and we're all trying to do things, and there's great examples of working elsewhere. So I think it just provides it provides a helpful overview and a sort of bit of direction of where we want to go. I mean, it is very detailed, so I think it feels like probably it's going to be a bit of picking what works as opposed to sort of using the document in its entirety. But I would certainly see it being beneficial. But I think the key thing is how it filters down locally in terms of how much visibility it gets locally, and how far it gets sort of pushed corporately to be used as a way of sort of checking and balancing what we're doing.
Okay. Is there anything that would help around that, giving it some bit more visibility, Michael?
I suppose it would probably be useful to understand, maybe, and let's say take Buckinghamshire for example, maybe who on the public health side of Buckinghamshire will be included in, seeing this and part of the signing off process, so we can kind of make those links there. Because I mean, what we have got at the moment is a lot of stuff coming from a lot of directions, whether it's prospectuses or plans or guidance and that. And I think the challenge is probably how we give this one sort of a little bit of airtime. So it's probably useful to sort of know, okay, if it's being signed off sort of across public health, how does that translate to who's sort of the local, use the phrase champions, maybe for want of a better phrase, within the sort of the local public health teams, who would those people be who are going to be picking this up locally? And so from our point of view, because I'm working on the housing side of things, who we potentially link in. Now, I suspect we're already linking in with them within the forums we got. It will just be kind of useful to know if they're getting this. I mean, I will, continue to promote awareness of this within the sort of homelessness cells that we're operating and the multi-agency groups we're operating. And if particular people in public health are picking it up locally, it would be good to know who they are so we can make sure that they're part of that conversation.
Okay. Good. Thank you. Really good point. So Jane O'Grady be the DPH for Buckinghamshire. We need to make sure that it gets cut through with Jane and her team, because I mean, clearly they're focusing on a whole range of things right now.
Absolutely.
I'm sure the kind of political pressure for a DPH around managing a time of pandemic is really very, very challenging. So she may be aware, and she may be kind of absolutely signed up, but not necessarily giving it kind of number one priority, because there's so much else going on.
Absolutely.
So we need to make sure we think about how else we can help this to land well locally, given the DPH are busy people, and everybody else is equally focusing on what's right in front of them right now. So that's a really good point. Very well made, Michael. Thank you very much. We'll take that away. Great. Anybody else? Otherwise, I'll move on. All right. So we're rattling through the agenda. The next bit on the agenda was about future meetings and webinar content. So the way that we've been creating this network event is we've been having our weekly meetings. We've been having a sort of an ad hoc approach to topping and tailing the meeting with a little bit of content at the beginning around practice examples and so on, and then following that up with a bit more of a discussion, either about that content specifically or about the other things that are of interest to the network or the people have raised. It seems to be helpful. Certainly people keep on coming back to the meeting, so that's a good thing, and starting to make use, I think, of the networks that we have. And so that's been great, and we want to make sure that we're doing putting on content that's useful for people. So we do keep on asking each week if there's things that in particular that you'd be interested in hearing a bit more about, then do let us know. I mean, some of the conversations we'll be having over the next few weeks will be inevitably driven by the opportunities around the MHCLG money and the 23 million for alcohol and drug treatment that we heard about earlier on. But there'll be other things that we wanted to focus on as well. And so it'd be good to hear from you if you've got anything in particular that you're interested in hearing a bit more about. And I'll pause there if anybody's arrived with a kind of burning ambition, burning question. Colette.
One thing that I think would be very interesting going across all disciplines is a bit about telemedicine that people might be using for rough sleeping communities, and not only medicine but dentistry, chiropody, things like that. If anybody's doing anything innovative, I think that would be very useful for everybody.
Okay, thank you very much. Could I? Sorry, I'm interrupting myself with my echo. Put myself on mute. I'll answer. Brilliant. Could I wrap that up, Colette, in a kind of digital interventions? Would that cover your kind of your idea?
Yeah, I think it would. I mean, the use of telecare and telemedicine and everything, just how people are approaching it. Yeah, that would be lovely. Thank you.
Great, thanks very much. Anybody else? Okay. No problem. So what we've done is we've had a little think about what might be useful, and the reason I said is up in digital is one of the suggestions we've got is digital. We've got around 20 suggestions of the things that we might might be of interest to you as a group of people to have a conversation about. We've been introducing kind of practice examples. I'm keen not to call them best practice because sometimes these are innovative. We don't quite know, but people are trying things and seeing what works. And we want to really encourage people sharing their experience of trying things out. So we've got some ideas about different practice examples. I say around 20 different themes, which we have been putting into a little survey, which will circulate after the meeting today. So we'll send around a link to a survey and just ask each of you for each of those ideas. How interested would you be in finding out a bit more about that? So a sort of scale of 1 to 5. So there'll be a survey that comes around, gives this range of themes. It'd be really good to hear a bit more about anything that you think you'd be really interested to learn a bit more about. Anything that's not on the list that you think actually, on reflection, you'd really like to have a bit of a focused conversation about. Or if you've got a particular bit of practice that you would like to share with colleagues, then an opportunity to tell us a bit more about that so we can get back in touch and take that forward. So we'll make sure that comes around with the notes of the meeting. So that's the end of the agenda that we had for today's meeting. There is an opportunity for any other business. If folk did have anything else they particularly wanted to ask about or share, we've still got 20 minutes in the diary today for the meeting. If you wanted to ask any questions or put any suggestions to the meeting.